While menstruation is a natural and normal process, it is unfortunately often associated with shame, stigma, and cultural taboo. And while the woman typically serves as the health custodian for her own family, her own menstrual health and hygiene is a critical yet often overlooked aspect of public health and education. Maintaining good menstrual hygiene can dramatically improve a woman's overall health and quality of life, and the consequences of not doing so can prove catastrophic and multifold. So we thought we'd take the opportunity to debunk some of the most common myths and misconceptions surrounding menstrual health. To shed more light on the subject and help separate fact from fiction, I'm joined by a highly distinguished panel of domain experts. President of the Federation of Obstetric and Gynaecological Societies of India 2022, Dr. Hrishikesh Pai. Treasurer of the International Federation of Fertility Societies, Dr. Hrishikesh Pai, who is also the former president of the Federation of Obstetric and Gynaecological Societies of India, Indian Society for Assisted Reproduction, Indian Association of Gynaecological Endoscopists, and Mumbai Obstetrics and Gynaecological Society, President-elect of the Federation of Obstetric and Gynaecological Societies of India, Dr. Jaideep Tank, and the President of the Indian Society for Assisted Reproduction 2022, Dr. Nandita Palshetkar. With that, I welcome you to our special televised feature, For Her, With Her. An initiative by Alembic CSR presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynaecological Societies of India. So, Dr. Hrishikesh, I think that menstrual health and hygiene is increasingly becoming a non-negotiable, but we have a long way to go. And I think the conversation essentially starts with women developing a better understanding of their own bodies. That said, how would you broadly characterize a normal menstrual cycle?
So before talking about normal, I would like to talk about today's context. It is about menses and it is about supporting the woman right from her childhood till her older age. And this campaign of For Her, With Her is very important to support them right till the end. And coming to the normal menstrual cycle is around 23 to 35 days. Normally we calculate the first day of period as the first day of the menses, and the last day is calculated as the first day before the last day before the next menstrual period. Sure. So that's the time duration of the cycle, and normally the bleeding is between 20 ml to 90 ml, and it lasts for 2 to 7 days. So that is the normal cycle, and generally these cycles start between the ages of 8 to 12. By 12, more or less, the cycles are well established and they go on till the age of around 51. So you will be surprised that in the entire lifespan of between 12 years and 51 years, a woman bleeds nearly 480 times.
Wow.
So that's how the normal cycle is operational.
All right. And if I were to come to you now, Dr. Rishma, given the sheer range and types of products available in the market, it can sometimes get very overwhelming to even understand what constitutes good menstrual hygiene. So how would you put it in your own words, and what are perhaps some of the leading consequences of neglecting one's menstrual health?
So actually, menstrual health and hygiene, unfortunately, like you said, is a really neglected topic, but it's extremely important. And what it really implies is access to menstrual hygiene products, like, for example, pads or tampons or menstrual cups, basically to absorb or collect the menstrual blood. Privacy to be able to change these menstrual products as and when the girl needs to, and giving access to facilities where she can dispose these products nicely, carefully, in the right manner. But, if you don't maintain this basic menstrual hygiene, there can be a lot of consequences like bad odor, infections, skin rashes, itching, infections not only of the vagina, urinary infections, so also pelvic infections can occur. So it's a very, very broad issue, and it actually gives us a lot of insights into the situation the girl is in. There are a lot of unmet needs. So, menstrual hygiene is a huge issue and involves lots and lots of areas in a woman's health.
Well, Dr. Rishma, you've summarized it well, and I want to build on some of your observations and bring Dr. Jaideep into the conversation now. And Doctor, I'd love your take on the extent to which menstrual complications can affect a woman's psychological frame of mind.
When you talk about the psychological frame of mind, I think you can perhaps not have a better kind of a frame of reference than for her with her, because that is really what we need. We need to ensure that women who have menstrual problems, or even those who have normal menstruation, never feel alone. Unfortunately, menstruation, despite the fact that it's existed since humankind began, is still very taboo. It's not exactly dining table conversation. Absolutely. And when you want to talk about menstruation, you are actually referring to something which is physiological. And when I say physiological, I mean it's normal. It's not a medical condition. And there is a gap between expectation and reality. And I think this gap between expectation and reality, to a certain extent, comes from peer pressure also. When girls start menstruating, or even when women menstruate over a period of time, as a gynecologist, I'm always getting told that my friend told me that this was not normal. And when a peer tells you that something is not normal, you tend to get anxious about it.
Absolutely.
So at the end of the day, what this results is in a lack of awareness, which ultimately lead to anxiety. And that's why you need to temper your expectations. You need to understand what actually happens. Once you do that, you accept menstruation as a part of your life. And once you learn how to accept that, you reduce the psychological burden of menstruation, so to say.
So, Dr. Jaideep, two of the critical points you touched upon were, of course, awareness and acceptance. And building on that, coming to you now, Dr. Nandita, what are some of the healthy habits that menstruating women can implement immediately, irrespective of their age, irrespective of their socio-economic background?
I think the first thing that actually the girls need to understand is to choose the right product. Maybe it's menstrual cups, because today it's the green revolution that's going on. So they're being promoted, and the pads are available. Then also what is important is changing it frequently, or, because 4 to 6 hours is the time. Now, if you're bleeding heavily, then every 2 hours would be a good time to change it. I think this awareness, the girls need to understand that. Third is hand hygiene, washing hands after this. I think these are small things which need to change. Then, holistically, I think we need to look at it holistically. Eat a good diet, fruits, vegetables, a lot of grains will help in your cramping, will keep you well hydrated, because that reduces your bloating, etc., all those feelings which you feel during your menstruation. Mental hygiene, I think it's really important, because girls are suffering from premenstrual syndrome, and 50% of it we gynacs know that you can control it. So when you're aware that this is going to happen, you're more aware of it. And I think we must bring the boys or the husbands into it. Very, very important that the male counterparts of the family need to look into this and need to be aware of it. I think all these things. And one thing I want to get in here, I think I really appreciate our Prime Minister for her, with her, the toilet program which he started. I think toilets for women, for this menstrual health, is so important. So I think, it's nothing. We just need to talk to the younger girls. We need to make them happy about it, happy about being a woman. I think that is what it is all about. You are a woman, that's why you menstruate. It is your right to menstruate.
Well, thank you, Dr. Nandita. You've really helped humanize this conversation. And if I were to come to you now, Dr. Rishma, if you could also help outline some of the typical menstrual problems that one may encounter, across all ages and stages of the life cycle, from, say, puberty to premenopause.
Yeah. Unfortunately, many girls go through abnormalities in their period, and it could be anything ranging from very frequent cycles coming in sooner, every 15 or 20 days, delayed cycles, or not getting a period sometimes for 1.5, 2, 3 months, or getting periods only if you take medication to bring on the periods. And then, of course, there's associated pain, or what we call dysmenorrhea. So lots of problems of menstruation can happen to a segment of women, particularly when they go towards menopause. Then bleeding irregularities is common because it's declining hormones in the body. So the bottom line here is that menstrual problems can happen. However, there is a solution or a treatment for everything almost. And the moment it's good to maintain a menstrual calendar. Nowadays you have apps, you can follow the app so you know exactly what's going wrong, and seek the help of your friendly neighborhood gynecologist so that they can diagnose early and treat early.
Absolutely. And Dr. Nandita, bringing you in now, because I think Dr. Rishma just touched upon abnormal uterine bleeding. How is abnormal uterine bleeding typically diagnosed? What are the tests one must undergo to come to that conclusion?
I think once the patient comes to you, I think the most important thing is history. As Dr. Pai has mentioned, the normal things, so we diagnose, we ask for the history. So once we diagnose from the history, then we go on for testing. Obviously, the tests that we do, the first one that we really depend on is the ultrasound. It tells you if there's anything in the uterus like fibroids, polyps, or adenomyosis, or even the ovaries. Sometimes the ovary has cysts, which causes an abnormality in the cycle. Then the blood tests are also important because even hormonal imbalances can cause abnormal periods. Then polycystic ovary, it's so common. The PCOS or the PCOD is so common. So ultrasound, the sonography, the blood tests, and then we do a little invasive test. One is the biopsy, which we used to do. It's a blind biopsy. A lot of people don't like to do any, undergo hysteroscopy, which is a telescope which we put into the uterus. We actually look at the cavity of the uterus and then take a directed biopsy. But that is to be done in every 40+ woman.
So once one has been diagnosed with this condition, as Dr. Nandita outlined for us, then Dr. Rishma, what are the typical courses of treatment available? And coming to you, Dr. Jaideep, how do you in your practice essentially help guide the patient as to the most appropriate course of treatment for their scenario and their situation? We'll start with you, Dr. Rishma.
So obviously the treatment is going to depend very much on what the problem is. And nowadays we have a lot of non-hormonal treatments. So often the first line of treatment is very, very simple. She comes with heavy bleeding. We just give her medication maybe 2 or 3 times in a day for 3 days, and the bleeding will reduce by at least 50%. And if we find that it's a significant hormonal imbalance, period is coming every 15 days or not coming for 2 to 3 months, then we need to put her on hormonal therapy. And of course, then if there are specific conditions, then you need to treat for that particular problem which you've diagnosed.
And Dr. Jaideep, if you could please build on that.
I think when you talk about abnormalities of menstruation, the first thing we should be emphasizing is that the range of normality in menstruation is so broad that defining an abnormality becomes the first and most important thing.
Exactly.
What may be perceived as abnormal may not actually be abnormal. Typically, women and girls get information from, and I will not hesitate to say this, inauthentic sources of information. There is a whole lot of information out there, and most of the information that is available is half-baked. And that's why the first thing you need to do is ascertain whether there is an abnormality or not. The next thing that we talk about when we look at these so-called menstrual abnormalities is at what point in time is the woman in her life cycle. There are essentially 3 points of time in a woman's life when it is normal to have variations in your menstrual cycle, and these are in puberty, immediately after pregnancy, and just before the menopause. These are all times when the hormones in the body are getting reset. And lastly, you need to consider the economic cost. It's not that all menstrual hygiene products are very cheap. So I think these are all broader issues to be considered, and I think we need to start talking a little more about this.
Well, Dr. Hrishikesh, I'd love to weave you into the conversation now and understand the impact of abnormal uterine bleeding on a woman's possibility of conceiving and having a healthy pregnancy. Is there a connect between the two, sir?
So actually the infertility, sometimes there may be symptoms of abnormal bleeding in an infertile couple, and it's the underlying cause. For example, you may have polyps or you may have fibroids. So these can manifest as abnormal bleeding, and they are actually the causes of infertility. So normally when a patient comes to me who's an infertile couple, I also would, as Dandita had said, that I would do an ultrasound, I'll do hormone tests. We typically do TSH level, that's a thyroid hormone test, and then we do prolactin level. So with that, we come to know whether there's any major cause. And the ultrasound tells us whether we have endometriosis or adenomyosis. So by doing this test, we can pick it up, and then we obviously treat those disorders, and that enables the patient to conceive.
Absolutely. And Dr. Rishma, coming to you now, Dr. Hrishikesh just touched upon fibroids, and fibroids in a woman's uterus is becoming an increasingly common occurrence. Is this cause for concern? What's to be done about it? How is it best managed?
Fibroids are extremely common in the young patients in the reproductive age group. As many as 20% or more girls will suffer from the problem of fibroids. So basically we address the problem of fibroids based on the size, the number of fibroids, and the location, most important. So if you have a uterus and the fibroid is on the inner side, even a tiny fibroid will give a lot of bleeding. And the treatment really is specific. You actually go with a small telescope into the uterus through the vagina, and you literally shave off that fibroid. So it's very nice for the patient. The treatment takes like within half an hour, half a day of hospitalization, patient can go home. There are no cuts, no stitches, nothing. However, if the fibroid lies on the outer surface, like it's a large fibroid here, so if that is there, then we can actually do keyhole surgery, what we call laparoscopic or endoscopic surgery. So these are essentially surgical options. There are medical options, very few drugs, not 100% safe, so we are a little scared to use medicines for fibroids. And then there are these newer non-invasive therapies which are becoming more popular. For example, we started actually a few years ago in Asia for the first time at Jaslok Hospital, the MRI guided focused ultrasound. So the girl just goes inside the goes inside the MRI machine, lies there for about an hour and a half, for example, and it's like heat waves or laser beams, you may call it, originating from there, which actually go inside and burn the fibroid. So there are lots of therapies. The bottom line is patients should be conscious of the fact that her period cycle has changed or something is not normal inside her, get it diagnosed quickly, and there are many, many therapies available.
I think that's very heartening to hear, and a term that has again repeatedly come up in our conversation is polycystic ovarian disease, and that too, occurrences are on the rise. What are the symptoms? What are the causes? And is there in fact a cure?
I think polycystic ovarian disease has really changed over the years. If you look at the symptoms, irregular periods is one of the most common symptoms. Then the other thing is if you're increasing weight, that also is one of the symptoms. Then, the face, the acne, the hair hirsutism. Some of the girls have unwanted hair on the face, on the body. Those are signs. Then another new thing that has come, like 150 institutions have got together, and they have realized that mental symptoms are a sign of polycystic disease. Polycystic ovarian disease, because of the pathophysiology that it causes mental symptoms like depression, anxiety, etc. So we need to be aware of these things, that these things do happen to girls. So I think it's very important for counseling. I think it's a disease which is there throughout your life, and you have to watch it from adolescent to tomb, I would say.
No, it makes absolute sense. And Dr. Hrishikesh, I don't think we can possibly have a conversation around menstrual health without bringing up endometriosis. And I think it's an often overused and poorly understood term. So for the benefit of our viewers, if you could help break it down in layman language, sir.
It's very enigmatic for us also, even now. It's basically the lining of the uterus outside the actual normal location, that is in the cavity. So it can be in the abdomen, on the peritoneum, that is the lining of the abdomen, or on the ovarian surface, or inside the ovarian substance. So that's called ovarian endometriosis. And it can sometimes penetrate the muscle of the uterus as well and go into the muscle, that's called adenomyosis.
Sure.
So it's a internal endometriosis. So these are things that happen, and then many of them are asymptomatic, or they may come as painful periods. That's a main one of very important symptoms, or painful sex also. So it's called dyspareunia. So these are some of the symptoms, and nowadays with the 3D ultrasound that are available to us, we can easily make out whether there's an endometriosis. And once you diagnose it, suppose there's another problem. The adolescent girl can also have endometriosis. So we have to be less interventional in adolescent. We don't want to try any surgeries, or we try to give palliative treatment. In the reproductive age group, they want to have kids.
Right.
Obviously you would do some intervention. There are a lot of medicines that are available. Just by taking them, they become, they get their pregnancies. Or if not, then we can do endoscopy. As Rishma was saying, you can put a laparoscope and do surgery, and you can treat them and they become pregnant. And of course, the holy grail is always there. You can do IVF for the people who don't succeed. So there is a lot of spectrum. It has to be managed for pain as well. So pain is a big symptom, and the second symptom is infertility. So once you manage these two things, you more or less can manage the endometriosis quite well.
So Dr. Jaideep, to my understanding, Menorasia refers to bleeding that lasts in excess of 7 days, right? And it's often mistaken or misunderstood to be normal menstrual bleeding. How do you distinguish between the two, and what is perhaps the long-term health damage, if any, of this condition?
Menorasia, as you said, is excessive bleeding. This excessive bleeding could occur in two situations. One is that the patient bleeds too much during the menstrual cycle, or she bleeds too often, or she bleeds in between menstrual cycles. And the approach to each of these issues is quite different. How do you make out that the patient has Menorasia? It's relative. And when I say it's relative, I would say it's relative to her previous menstrual cycles. And most of the times, the best treatment for Menorasia is be objective about it, look at whether it's affecting her truly, and if it is affecting her, get a blood count done. And if the blood count is low, then investigate her and be a little more aggressive in her treatment. We always try, as everyone has said, conservative treatments first, and surgery is really quite the last option.
And coming to you now, Dr. Hrishikesh, by way of closing comments, what more can we do as a society, to encourage more open, honest, and comfortable conversations around prioritizing menstrual health and hygiene, sir?
So basically, today's conversation is for her and with her. Right. And basically, if you look at the overall, our country is 1.4 billion. It is now the largest populated country in the world. And menstrual health and hygiene is a very important aspect of women's health. And we have to not only think of the educated, but we have to also think of the underprivileged. Our 1 billion people are underprivileged, and we all who are sitting here come from the FOGSI, what is the Federation of Obstetric Gynaecological Societies of India. We are the federation, we are the custodians of women's health. We have 40,000 gynecologists. We take care of women right from the beginning till the end. And the most important thing I feel is education. We have to educate the people right from the school days. This has to be incorporated in school education, and one of the parts of this campaign for her with her is to go to the school kids and educate them right at the beginning and make it a part of their standard being. The second thing is we must make things available. She said that Pradhan Mantri felt that the toilets are not there, शौचालय नहीं है, तो वो availability करके, but we also have to make them use them, the availability, and this is all a broader issue of development. And that's, so our country is developing very well. We are very happy. Our maternal mortality rate has come down, and we are very positive that with this campaign it will add. It's a, you know, in our Marathi we say thembe thembe tare sache, means every drop counts. Ultimately, it's the larger vision of a greater and prosperous and healthier India which we are looking at.
What a power-packed panel, and thank you so much for joining us. With that, our special feature, For Her, With Her, an initiative by Alembic CSR, presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynaecological Societies of India, comes to a close. We trust you found the insights shared of value. Thanks for watching.